Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Rikki Hooper, Four Seasons Chief Clinical Operations Officer, and Jenelle McCallum, Teleios Collaborative Network's Chief Clinical Operations Officer and Organizational Coach. Thank you both for being here today.
Thank you. Thank you for having us.
Well, I'm really grateful for the conversation that we're going to be able to have today because it's one that is really important to many of us, and it is important to myself. As I was reflecting on this one, I thought about my first experience with hospice care. And it was right here at Four Seasons, right after we had opened our inpatient unit. My grandparent was served, and I tell you, we had the best experience. But had we not had the opportunity to be served by hospice, it could have had a very different impact on not only my grandparent, but our entire family. We'll still talk about the tremendous support and the very intentional, personalized care that my grandparent and the family received. And so for our listeners, I want us to think about, have you had someone experience hospice care before? Or perhaps you or someone you know may be considering learning more about hospice for when a need comes. This session should help you in doing that because we're going to really understand the levels of care that's provided in hospice. And I want us to know that sometimes it can be confusing and it can be even concerning to try to figure out what the right care is at the right time. But by calling Four Seasons or reaching out to us, we can help you navigate all of those options. All you have to do is contact us. At any point in time, our listeners have questions, we encourage you just reach out to us. Four Seasons have been providing hospice services since 1979, and we are grateful to provide hospice services throughout 14 counties throughout Western North Carolina, as well as other services that you've heard about and you can go on and read about, like palliative services. So I have a question first for Jenelle. Some of our listeners may already be familiar with the term levels of care with respect to hospice, but we may have some that are not. They may even be unsure of what hospice is. So could you just describe hospice and specifically just the term levels of care?
Be happy to do that. Hospice, as we know, is this layer of support for families and patients who are struggling with advanced illness and need that end of life support. Medicare requires that all Medicare certified hospices provide 4 levels of care. It's really based on what families and the patients need at that time. As you said earlier, Millicent, we don't want families to be worrying about the levels of care. That's what Four Seasons is here to help figure out. But just so that people are aware, the most common is called routine home care. And that's when a person's symptoms, such as pain, nausea, shortness of breath, are being managed pretty effectively with regular hospice visits. Most often, that care takes place in the home. And it could be in a private home, assisted living, or a nursing home. That's the most common level of care, routine home care. The second level of care is general inpatient care. You might hear us refer to it as GIP. And that level is used for very short periods when symptoms become pretty intense or complicated to manage in the home setting, where the person needs close monitoring and more aggressive symptom control. Often at Four Seasons in the hospice inpatient unit, Elizabeth House. It can be provided in other care settings, like a hospital or a skilled nursing facility, but most often at Four Seasons, it's provided in the hospice inpatient unit called Elizabeth House. The third level of care is called continuous home care. And this can be provided during a crisis when a person needs extended hours, of care in the home to get really difficult symptoms under control. The goal is to address the crisis without having to have the person move. And the fourth level of care is called inpatient respite care. This care is designed to support the family caregiver. This one in particular is designed to support the family caregiver, giving them a brief break from providing hands on care, where the person can stay up to 5 days in the inpatient unit, for example, or a nursing home, as long as, again, we meet the criteria for that stay. And this level is about caregiver needs rather than a change in the patient's symptoms. So, those are the four levels of care for a Medicare certified hospice.
I think you gave a really good overview, and our listeners might be saying, I'd like to know a little bit more. And I would specifically like to know a little bit more about what I could expect with these levels of care for Four Seasons. And Rikki, could you expand a little bit further? Because as we think about the levels of care and how Four Seasons meets the needs of our
Mhm.
community, I'd love for listeners to hear a little bit further.
Yeah. So, as Janelle said, the vast majority of our patients' needs are provided by our routine home care team. And when we say routine home care, that means wherever the patient calls home. And so it could well be an assisted living facility or a skilled nursing center. But the vast majority is in somebody's individual home. And that generally is provided by a team of clinicians who are well versed in delivering hospice care, headed up by a registered nurse who will usually make a routine visit about once a week. Sometimes it's more frequently, sometimes it could be every other week. Just really depends on, again, on the patient's needs. Our team includes a physician or a nurse practitioner that's able to make visits at home. And then also social work, a chaplain, and we do offer music therapy here at Four Seasons. And so that's a great tool to be able to address symptoms in a non pharmaceutical way. And then our home health aides, of course, are invaluable to be able to assist with personal care in somebody's home whenever the caregiver needs some assistance and those needs could be assisted by the team. As I said, our team does usually visit about once a week, so the registered nurse will make a visit. We do have nurses on call 24 hours a day, 7 days a week, and so sometimes things happen outside of the regular office hours, if you will. And in fact, very often those things happen outside of regular office hours. And so calling Four Seasons at any time allows you to be able to speak directly with a registered nurse on our triage team. And they're able to get somebody out to be able to either assess the situation or to help by phone in order to meet the needs that we might encounter at that time. When routine home care does become not enough to meet somebody's symptoms, when someone's symptoms get to the point where they're needing more medication or more frequent medication, certainly that can be provided under the general inpatient level of care, as Janelle said. And we are able to provide that for most patients in our inpatient unit located in Flat Rock. But we also have contracts with a number of other locations in hospitals across our region and a couple of different skilled nursing centers to be able to provide that there for those short term needs. And as we touched on briefly, continuous home care can sometimes be an option when we think that that is going to be for just a few hours or while we're waiting for a bed to be open at the inpatient unit or the ambulance to be able to be available. And that seems to be one of the challenges that we have is finding appropriate transportation to get someone there. Respite care, as we said, at Four Seasons is often provided in our inpatient unit, but again, we do have contracts with a number of other facilities across our 14 counties where respite care could be provided closer to someone's home or in a center that maybe the patient or the family are familiar with, and that could meet the patient's needs more specifically, particularly for those patients who do suffer from some memory issues. And so having somewhere where they can be secure and safe is important to caregivers when they're already feeling stressed and very often struggling with the idea of turning over care to somebody else other than themselves in their own home.
You know, you said so many important um, considerations that I hope our listeners were able to hear. And so often, when you are experiencing the need for hospice services, whether it's for yourself or it's for a loved one, there's so many questions that could race through your mind. And one of the things that I'm so proud that Four Seasons has confidently and consistently provided is support for the caregiver. If you've ever been in that role, which many people have, it is incredibly challenging and very tiring. And so, one of the things that Four Seasons is very well aware of and spends significant time in is making sure that we are providing tremendous quality care to the patient as well as the caregiver and their family. And so I don't know if there might be anything else you'd like to add to that, Rikki or Jenelle. Perhaps either of you may even have a story, but I'd like our listeners to know that we take care of the whole person and those most involved people. And so as you were talking, that was just really important. Another thing that was important was that 24/7 care. And so there may be a schedule, which in fact there will be as part of the plan of care, that you'll know when individuals as part of our interdisciplinary team will be coming. But anytime there's a need for additional support, all you have to do is contact us. And so that 24/7 care is really crucial, as well as that support for the caregiver. And I also wanted to mention something around the veteran services. We have um, tremendous care for everyone of all ages, whether it's a pediatric patient or a patient who has served us through the military service. Those are special opportunities to customize care. We always ask what's most important to you and to your most involved individuals. And so that matters. The frequency of visits, the care that's tailored to the patient and their loved ones, 24/7 care available wherever you call home. And then that support for caregivers, those are just very important. So, Rikki, Jenelle, any of that you'd like to talk a little further on?
Yeah, I think I can probably cover a few of those points just with over the years you meet families and you were able to participate in their journey, and so we're able to really have those people stick in our memory. And I remember one gentleman who was in his late 50s and unfortunately began to experience some early onset dementia symptoms. His children ended up having to be his primary caregivers, who were in their 20s to 30s, obviously with small children of their own. Um, and that was challenging for them to be able to care for their father, who had previously been this person that took care of them. Now they were having to care for him in all ways. He was a veteran, and so over the course of the home care period of time, they needed to access the triage team, the after hour support team several times when he might fall. And he was a tall gentleman, and they couldn't pick him up off the ground, so he needed help to be able to kind of get back on track. His memory issues and his dementia really resulted in some agitation, and so medications needed to be adjusted. Toward the end of his life, the symptoms did get such that he needed to be admitted to the Elizabeth House, to our inpatient unit, and they were able to care for him there for probably about 8 days before he died. During that time, our team was able to do a veterans pinning ceremony, which was amazing for the children. So all four kids were able to be there with some grandchildren, and that was super meaningful for them. It's hard when you lose a parent at any age, but particularly when you're young, and then all of a sudden the burden is on you to have to provide this care. And having spoken with members of that family since, they've just expressed immense gratitude for the ability to provide that gift to their dad, because if they hadn't have had Four Seasons, they would have had to place him in a facility and didn't want to have to do that. So I think that it was just incredibly impactful for them to be able to provide care for him at home under and take advantage of several different levels of care.
Thank you so much for sharing that. I mean, it's so important as we think about, valuing each other and supporting each other. That's what Four Seasons is focused on. Our mission is co-creating the care experience. And so it's valuing, it's respecting, and making sure people receive the right care at the right time. And the right care is, again, customized for them. I love that that individual and their family received the care where they needed, when they needed, and the patient was able to be honored as a veteran and the family was able to be supported. And that's one of the things that I love so much about Four Seasons Care is that we don't stop caring once a person passes. We continue the care while they're in our services and beyond. And so that's very important. Another thing that you mentioned that is important for our listeners to be aware of, sometimes based off of the diagnosis, we may think, I don't know that that hospice or that provider has the skill set or the experience. And that can be really concerning. I want to assure our listeners that at Four Seasons, we have a process for all of our team members that's called a learning plan. And we invest in as well as support individuals in providing opportunity to learn and to gain expert training and even certification in specific diagnoses like dementia, as you mentioned with that patient, or cardiac, or even pediatric care, and the list goes on. So, if you or Jenelle would like to share any more about this, just knowing that we are committed to co creating means we're constantly in the mode of listening to what's most important and equipping our team to provide the care that's needed.
As I was listening to both of you, what I started thinking about, I mean, we started out with levels of care, right?
Yeah.
And that all levels of care are important.
So
And
important.
Rikki, your story demonstrated those different levels of care in such great ways. And I feel like it's important for all to know that they're available at Four Seasons and that this should give you peace of mind. I mean,
Yeah.
to know that Four Seasons can provide all those levels of care and get to know the person and the family so well, and to have people feel deeply known, not just as a patient, but as a person and as a family, I believe is such a gift. And Four Seasons realizes that these are precious times and that even though we might call one level of care routine, they know it's anything but routine
Yeah.
for the
Absolutely.
family and the
Yes.
patient. It is a sacred, beautiful time. And that's what that reminds me, to say that um it's an honor
Yes, it
for
is.
us as hospice staff and volunteers to be part of people's lives.
Thank you so much for sharing that. And, it makes me think about something that either you or Ricky mentioned earlier about how we have a full team of expert that come alongside, again, to listen to what's most important, who genuinely care and want to offer, as you stated, that peace of mind. One of the admissions that I went on, I still remember the beautiful opportunity to learn about the patient's story. And while the patient was not at a space where they could share, their loved one shared and showed pictures. And just hearing about what was important to that patient all throughout their life was so valuable to me. And I know to the nurse and to our team because our team members make a note of that and respect what's most important. And remember that every person we serve is a person and they have a story and they should be honored. And so that's very important in how we approach care. Likewise, one of the things that is unique to Four Seasons that not all hospice providers provide is visits from actual providers wherever they call home. All hospices have providers involved, but Four Seasons goes that further extent. And maybe Ricky or Janelle, you could share that. In addition to what's required, we're going beyond to say, hey, if this is important to you, if this is important to your loved ones and important to the care team, we're going to have a physician come. We're going to have music therapists outcome. We're going to have, again, whatever is most important to you. And so, could you share just a little bit more about our unique ability to listen, to learn, and to provide true care?
Yeah, Jenelle, I know you've worked in other hospices where physicians are not always part of the actual care team on a day-to-day basis. Very often, a hospice may not have a physician that can go make routine visits other than as the requirement mandates. What has your experience been in comparison to the model that we use at Four Seasons, where we do have physicians available or a nurse practitioner that's available to be able to go and see patients in their location?
Four Seasons sets the bar very high in terms of having providers, physicians, nurse practitioners who can visit and will visit patients in whatever setting that they are. And that is unusual across a lot of different hospices who all have the required physician and providers, but Four Seasons goes beyond that and has much more opportunity and expertise with their physician on staff.
Thank you for sharing that. In thinking of hospice care and why someone should reach out for care, I hope you've heard quite a few reasons today. I'm wondering if, Jenelle, if there's anything else important for the community to know about the levels of hospice care from your perspective. Anything you feel like you'd like to leave our listeners with?
Think just again to remind folks that all the levels of care matter to Four Seasons and they are available. The families and patients don't have to worry about deciding and working their way through that. That's what Four Seasons will do for you. Giving you peace of mind through this whole journey is what we're here for. And I think that is what's really important. I think about my own journey with my mom, who is in hospice in another state. And just knowing that I have hospice support is incredibly, I can't tell you what relief that has given me and peace of mind, as well as knowing there's expertise. And so I wish she was living in the Four Seasons market, honestly. But I because I have such confidence in their expertise and their passion and their love for their families and their patients. And so that's what I would want this community to know, that you have a beautiful jewel in Four Seasons. And I encourage you to use it and learn more about it.
Thank you so much for sharing that. So, Rikki, how could someone be referred to Four Seasons for care?
That's a great question. There are a couple of different ways. One is simply by picking up the phone. Just call Four Seasons. Our phone number is listed on our website. Most doctors' offices in the region will have it readily available. You can ask your provider, your primary medical provider, or another specialist to refer you. There's also a link on our website to request care, and you can use that as well to be referred or to just get more information.
Well, however you would like to reach out to us, we just encourage you to reach out to us. You having confidence that you or your loved one will receive the quality care that is truly customized to meet your needs is important. And I'm grateful that levels of care exist, that we are able to share with you about those today. But most importantly, I just want you simply to know that Four Seasons has been serving our community since 1979. And every single individual that we've had the honor to meet and to care for is why we continue to truly be the trusted care provider in the area. And we want to continue to find out what's most important to our communities and meet and exceed those needs. So, thank you for joining us today. For more information about our services, please visit us at fourseasonscare.org. And like Rikki shared earlier, you can also call us at 1 466 9734.
The Quality of Life podcast is produced by Four Seasons, the care you trust. providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.